Kleinbob. I'm the Executive Director here at Regional Center of the East Bay. And just to introduce you, we have Mike Minton, who is our Quality Assurance Supervisor. And over here, we have Lucy Ravello. You need to come into the screen. And Lucy will be talking about some of our nursing issues. She's wearing a mask at this point. I'm going to start by sharing my screen with a PowerPoint and go through a few of the things about the state budget and where we're at. And then I'll turn it over to Lucy and Mike for most of the PowerPoint presentation. So today we're going to talk about reentry into the community. And that's something that we'll be thinking about for the next 6 months, I'm absolutely certain. I wanted to first give you the news about the California state budget. A couple of weeks ago, we were very concerned about the impacts in the state budget on our service system. And I'm really happy to report that the budget that we expect to be passed by the Assembly, it may have been passed already by the Assembly, it was passed by the Senate a couple of days ago, and it needs to be signed by the governor, doesn't include the reductions that were included by the governor in the May revise. No areas of developmental services are projected for rate reductions. And in January of 2021, early start services and independent living services will receive an 8.2% rate increase. So that's great news, and we're glad about that. There continues, though, to be a need for more federal funds. And if federal funds don't come in, or if revenue projections from taxes don't meet expectations, we could see some additional meetings by the legislature to revisit decisions. But at this point in time, it's very good news. The other good news is that there was proposed reductions to adult Medi-Cal services as well as to IHSS, and both of those are not in the finalized budget. So good news all around. I'm going to turn it over to Lucy Ravello now, and Lucy will talk about COVID-19 and some of the health provisions involving our transition to the community for services.
Hello, that is me. I am Lucy Ravello. I'm a clinical director here at Regional Center. If I haven't met all of you, thanks for joining us today. We will talk about just a few tidbits of information around COVID as it relates to our the people we serve and our community. And there's plenty of time for questions. If I gloss over something that you are interested in knowing more about, please let us know with a question after the presentation. So I'm updating some information, but it's already old with the data from the state about the number of people that we serve statewide that have had a diagnosis of COVID. So these numbers are from our Department of Developmental Centers COVID site, our page, and there's a link or a tab on the page that gives you all the statewide data and then also specific data about each regional center's clients who have been tested positive. So these numbers are just about how many clients total statewide that we all serve, and that's a large number, that 353,000 number, almost 354,000 people statewide. And then the total number of people that have tested positive in the state is around 596. Oh, did you update these? Thanks, Lisa. They just updated as of these numbers, I thought, are around last week as when DDS updates, but every few days they'll update numbers. So these may even change since the time that I put these slides together. Deaths unfortunately, statewide are about 52. And that's total in the state. For us at Regional Center, we have about 22,000, that large number of total population of people we serve in the Bay Area. And then we've got only, luckily, which is unfortunate, but still it's only about 15, 16 people that have tested positive that we're aware of from reporting from case managers to us in the health unit, and then one person who has passed away, unfortunately, from COVID related illness. So those are numbers. Sorry, it's kind of dry, but we got that over with. Now we'll go on to, how do I change the slides?
Yeah.
There, okay,
Yeah.
I did it. So I'm just gonna talk quickly about requirements. I'm sure you're all blasted with this information on a regular basis if you look at the paper or look at the news. But as both of our counties ease into the different phases of reopening the community, businesses, and community gathering places, the restrictions for wearing masks and limiting contacts with people outside a consistent group of 10 to 12 people remain in place. Those haven't changed. And we have also gotten an order recently, on the 18th, from the governor to enforce that everybody who is outside wears a face covering. And that can be a cloth face covering, that can be a face shield. We can talk about some different types of face coverings a little later. But, and that's in all instances, except for a few exceptions of when that physical distancing or social distancing, it's called, when that space between people can't be known or assured. So at least 6 feet, I've heard up to 30 feet away from people as the virus is shared through the air droplets. And so there are some exceptions. I'll talk about that. The governor specifies that the little ones under 2 years old should not be forced to wear a mask, as it can lead to some dangerous situations where suffocation might happen if not monitored closely. So that's a high-risk population that should not be forced to wear masks. And then also people with medical conditions where their breathing is affected, or they're intubated, or they have some medical reason why they should not wear a face covering. Those people are also excluded from this rule or requirement. And then people with medical conditions, other medical conditions, mental health conditions, and disabilities that prevent someone from wearing a mask. Even specifically, he talks about if they're not able to remove the mask themselves, then those folks might consider wearing something else like a face shield if they're able, or prevent going out in public places where they'll be close to others to reduce the risk of them spreading illness or them getting a virus-related illness. So, and then those face covering is also in combination with the continued recommendations to continue with physical distancing as much as possible, and hand washing or hand sanitizing as often as possible, as it has been found that there's some viruses, some of the virus can live on certain surfaces for a little longer than an hour or two, and we don't want to touch those things and then accidentally touch our face or touch a loved one's face and spread this virus that way. Okay, moving on to my next slide is about testing. As testing has been expanding in the state and in our two counties, Alameda and Contra Costa, initially testing was reserved because it was so limited to people that were very sick and in the hospital. And then gradually it's been expanding to people who work with folks in the hospital who are sick, healthcare workers, and then first responders, some social service employees who are in direct contact with people frequently as part of their jobs, other essential jobs like grocery clerks and other essential jobs, gas station workers and things like that. So, and then it also has included this first tier of testing, included people that were symptomatic. So they had some signs of illness and they talked to their doctor, they got a doctor's order, and they were able to go get testing in some areas. Some areas were still, it was pretty hard to find testing sites and get those results in a reasonable amount of time. And now it's, most areas have expanded testing to anyone who wants to get a test should be able to get a test. Usually you'll need to call for an appointment at the test sites and find out what's needed ahead of just showing up. I know in Contra Costa, and I've added these links to locate testing. Actually, I'm not sure if those tests, those links are correct now that I'm looking at them, but if they're not, you can go to both county, either county that you reside in. Their website for COVID has resources listed on their websites for the testing resources that are closest to you. And then it will also advise on how to get a test if you would like one. And sometimes you don't need a doctor's order, sometimes you do. Sometimes, most often you don't even need insurance. They may ask what your insurance is, but that you should not be charged for testing at most sites. And there are free and low cost options listed on these resource lists on both counties' websites. I kind of skipped over some of these things, but these were all the required folks that would need testing. We've been working together with our case management teams to kind of identify as a team on the clinical team when folks are moving from one place to another, so that we can make sure that those people have been tested, and we know that if they're going to a new home where other people live and work, that they won't be in danger of sharing this virus. Also, we've been following the public health guidance where if someone is moving or has been to a hospital or an emergency room or a other congregate type facility, that when they're discharging or they're leaving, going back home, that they also have a test before they leave, so we know that they haven't contracted the virus during their stay at the health facility, and then we can hopefully prevent the person from sharing a virus contracted with the people that they're going home to live with. And also, in addition to quarantine, staying home for 14 days after a positive test, or even if you're waiting for test results, we're advising that people stay home and limit contact with anyone else besides who lives in your home during a time that's unknown if you may have been in contact with someone with the virus. So moving on to my next slide, I think this leads right into this. I was just talking about staying home and isolating. If you've had a test, even if you suspect that you're not feeling well and you've gone and gotten a test, even in the meantime, before you've gotten the results, you might want to stay home to limit contact if you're not sure. But then if that test ends up being positive, you're gonna especially stay home. As long as you have symptoms, you're gonna take care of yourself as much as you can at home with home care, which is resting and drinking fluids and taking Tylenol or whatever medicine you can tolerate, if you can tolerate for a fever. And then if you've had contact with family or any other close contacts, that you let them know about your test result and ask that they also get tested, or recommend that they would also get tested, seek a resource for that, and let their doctor know. I forgot that part. Also, you're gonna let your doctor know, or your primary care clinic or healthcare provider know that you're having symptoms in the first place, or that you're feeling, especially if you're not feeling better after a few days of home care. And then seek advice from your healthcare provider. So I think you probably all have heard these symptoms, but I stuck them on here just to be sure that everyone knows about these symptoms of COVID. Coronavirus are cough or breathing difficulty, fever, chills, sore throats, headaches, muscle pain, or loss of taste or smell. So if any of those things are going on for you or for someone you are caring for or in close contact with, you're gonna stay home until you feel better, and actually even a few days, like 72 hours after you're feeling better, just to be sure that you are no longer going to share that virus with anyone else. And you're continuing to wear that face mask so you prevent the spread of the virus from you to others, and then also preventing others from spreading that their airborne possible germs and viruses to you. Let's see. And then just trying to think forward, as Lisa mentioned earlier, into the near future, and looking at our communities as they start to reopen some services, and thinking about, on a personal level, what conditions that may put you or loved ones at a higher risk of becoming ill if they do have the coronavirus. Some conditions that put people at higher risks of becoming really sick from COVID are listed here: asthma, autoimmune disorders, cancers, diabetes, heart conditions, including blood pressure, high blood pressure, and kidney disease, obesity, even pregnancy, and these are some other, like using a nebulizer, oxygen, or a ventilator, some other respiratory conditions where you need support from inhaled medicines or oxygen, or even being fed through a feeding tube can also increase your risk for chances and spaces where you may be exposed or become sick from being exposed. Also, they've found that older people, I'm sure people have heard this, but older folks that get the virus have a higher risk of becoming sick. I was looking at the data from the department on our website, and it looked like of all the 52 or 500, almost 600 cases within the state, that now about 45, the age group that has most been impacted is the age group between 45 years old and 64 years old. And then also males have a higher rate of being positive than females, but that may be who's been tested. Also, it's hard to tell where that data or those numbers come from, but so those are some of the risks, and I think I just mentioning them here because those are some things that you want to consider as being putting a person at higher risk once considering resuming, any kind of activities out in the community once we're leaving home more often, and risk increases when you're in an indoor space with other people versus being in an outdoor space. Also risk for contracting the virus increase when there's more people in a space, when that physical distancing can't happen consistently, and people aren't able to wear protective personal protective equipment like masks and or face shields, and can't wash their hands as often. So some of those things I think each person is going to need to kind of think about and then consider as they think about whether or not they could, whether some of the benefits of that social interaction that is also so desperately needed these days after months of sheltering in place, if that makes more sense to the person than the possible risk of being exposed and becoming sick. So hopefully that makes sense. That's all related in my mind. I'm not sure if that's something that everyone can follow, but shoot me questions later if not. And then my last little slide here is just about personal protective equipment. And at Regional Center, we've been fortunate to work together with the State Council on Developmental Disabilities to procure quite a bit of now some personal protective equipment. And that includes, you've also heard the term PPE, that's just the first letters of those words there. And these supplies we are working very diligently to get out to our clients and families through our case managers here. Also, we've had a few days where we have handed out supplies. One is upcoming tomorrow out of our Concord office. And then Mr. Minton will talk about how we're trying to get supplies out to our residential service providers and day program providers soon. And I just wanted to talk briefly about what type of supplies we've been receiving, because wearing any of these will hopefully help prevent the spread of COVID, and we really want to keep people as healthy as possible and avoid anyone more getting this. It's just, I don't know, it's not worth the battle. So we know that everyone can't tolerate a face mask or isn't able to talk or communicate as well when people are wearing face masks. So we've gotten some face shields, and I can show them. Oh, am I back on here?
No, I'm
Okay,
gonna stop
here,
your
I'm gonna put it on.
sharing. Okay.
I'm
There.
wearing a face shield, but I didn't wear it the whole time because it's hard to hear, but it's just a plastic shield, and it's connected to your person by a headband, a stretchy headband that goes around the top of your head versus a mask that, you know, or a face covering that will just cover and touch your face probably a little more than a face shield does. And in the research that we've been doing, it's equally as protective to wear a face mask versus a face shield. And if you've gone to any dentist appointments or doctor appointments, you may see healthcare professionals wearing both a face shield and a face mask, because they found that the combination of the two is the best protection that you can provide others, and then that others, it reduces the spread of COVID to yourself because it's covering, uh-oh, my throat is covering your eyes and your nose and your mouth.
Luckily, we can switch now.
With the face shield, yeah. I think I've covered everything. Yeah. I think I just mentioned one more time that keeping your hands clean, keeping surfaces clean with just warm water and soap is really great protection. So keep that up. We don't want to fall off with keeping our hands clean. We also want to wipe down surfaces that are frequently used often in the house clean with sanitizing wipes or soap and water. And then keeping space when out in the community. And as people go out in the community, it's also recommended by the health officers in our counties to check body temperatures, because temperatures can be one of those symptoms of COVID. So if you have a thermometer handy, and if someone's routinely going in and out of the house to a job or to a program eventually, or just out and about on a daily basis, or even irregularly, you want to check temperatures in the morning before you head out, just to see that that's normal for you, and also that you're not having symptoms of any other parts of the virus, so that you're not sharing that with people. Even if you're wearing a mask, it's still advised that you'll stay home if you're not feeling well. So I think that's
Okay.
my slides.
Let's
I'll
switch
hand it
seats
back
for a minute.
over to
Yeah.
Lisa, especially because I have my okay. Oh, unless you want to introduce Mike.
Yeah, so we're going to switch over to Mike Minton, and Mike is going to talk about some of the things that are going on for reentry to day programs. And hopefully Mike is unmuted.
I am unmuted.
Yeah,
Yay.
so you're going to share your screen with us, right?
Okay, I've done that, and I'm getting a couple choices. And so the screen I'm looking at says day programs reopening and reimagining. Is that what you're saying, Lisa?
No.
So it's not doing it.
Okay. Let's see. So why don't you start talking a little bit, and I'll get it up for you.
Okay.
Yeah.
All right.
I know you've memorized your screen.
Well, yes, I do. You know, I'm talking today about just the reopening of our day programs. And I want to be clear that that's just about the programs that the adults go to. This isn't about schools. That's a different conversation, and really the school system is directing that. But I call it reopening and reimagining because one of the things we're really going to need to hold on to in our minds is as they reopen, what they were is not going to be necessarily the things we're going back to for a long time. You know, this all started with shelter in place. And as like in the middle of March, we started getting cases of COVID here in the Bay Area, the day programs were kind of torn about if they wanted to stay open or if they wanted to close. Some just thought they should close, and some were trying to stay open. But on the 16th of March, the health department ordered the shelter in place, which really based on the numbers of size people could gather, the fact that we weren't supposed to leave the houses unless it was essential, and everything at that point in time closed. So within 2 days, all of our day programs were closed. The closing was very fast and very hard. It was jarring across the community. I mean, you all know that as much as I do. I preface that though as I start talking about reopening, because I think reopening actually may be a little harder for us because it's going to be more drawn out. There's going to be more questions. There's a lot more emotions about what's safe, what's not safe, what's the best decision, what's not the best decision. And those are just going to be really hard. Lisa, should I just keep going? Are you?
Yeah, keep going. I'm almost there, but keep going.
Talking about then, as the day programs reopened, when they closed, it was all the health department. It was all shelter in place, drove the whole thing about closing. As reopening happens, there's actually a number of agencies that are involved. The first, of course, is the health department. They're the ones who are going to be saying, what are the sizes we can gather in? What are the spaces we can gather in? What are requirements about shields and masks and all those things? So that's coming to us from the health department. Through all of this too, the health department has taken kind of the lead. They've been considered the experts or the ones that we should all follow. As we reopen, the Department of Developmental Services is also involved. They're beginning to start giving some guidance about what opening or reopening might look like and what things we need to have in place, the day programs need to have in place. The regional centers are definitely going to be a part of that, and that's everything from writing POSs to helping people figure out or advocate who is going back to program or maybe not. And then also just helping support the day programs and making sure they have the things in place they need to have in place. And then there's also, for a lot of day programs, they're also licensed by the state. So the Department of Social Services and Community Care Licensing will also be involved to some degree, giving guidance too. So before we had one agency closing, and now we've got 4 kind of in the process of reopening, which is going to help make it a little bit more confusing. But like I said, throughout this whole process, the shelter in place was really guided by the health department. But now as we reopen, it seems like DDS is going to take a little bit more of a role in giving us some directives about how to reopen. There's been, the last 2, maybe 3 weeks, a task force that's been working on some drafts about what those stages could be, what they should look like, and what kind of things we just want to make sure are in place.
I think I'm there, Mike.
Okay.
I'm hoping I'm there.
Down there.
And if you are, we can just go to slide 5.
Okay. 1, 2, 3, 4, 5. There we are. There.
All right, beautiful. So we have DDS creating some drafts about how we might proceed with opening. For our community, actually, we are very fortunate. The Friday after all the day programs closed, all our day programs started meeting virtually and starting to plan for what was going to happen next. They've been meeting every Friday, and their purpose really has been to just support each other, share information as much as they can with each other, and then collaborating on how to move forward. And together they've created a resource tool with protocols, ideas, policies, and all sorts of things that will get us moving in that direction when things do start reopening. Off the drafts that DDS is still working on, the things they are requesting, our day programs have already started putting in place. So we are above the curve thanks to the work of our day program, their creativity and their dedication and commitment to through all of this time. Lisa, slide me to the next one. Oh, this is the only time I ever get to give Lisa directives.
Yeah. Okay, you're on number 6. Way there.
So reopening again. These are just some of the things the day programs have started considering. Again, it's everything else that's on DDS's mind. And it'll give you a sense of kind of the work they're doing and the questions that are being asked. One of the first ones is just screening employees and people attending program daily, including taking temperatures, like taking temperatures as soon as they get off the van or they're coming into the program. Same with taking temperatures for staff, maybe asking people how they're feeling. Making plans on what to do if someone is sick during the day, like if someone doesn't feel well, how do we isolate them at the day program until they can be picked up? And then what happens the next day if we found out they were positive? And then how do we proceed with what's happening inside the day program? Work around making changes to entrances and exits to control flow of traffic. You might even, as people go into a day program, see like at the grocery stores where you have the arrows on the floor that says you walk this direction, you come back this direction. Again, just keeping people from having a lot of contact with each other. They've been working on creating policies to address like what visitors would like, who could visit the program, when should that happen. A lot of work on making sure they're communicating that with families and the folks we serve and their staff. Lots of work around trying to obtain PPEs, all the things Lucy talked about for day programs, trying to figure out which ones make the most for them. We have, as Lucy referenced, a 2 days next week where we're going to be handing out things to day programs, ILS, SLS providers. Cleaning and sanitizing throughout the day and the night, just what needs to be cleaned and wiped down and what's the best way to do that. In their binder and their joint collaboration efforts, they've created a resource list of just about anything they might need when they come up with questions they don't have answers to. Lots of conversations and policies about hand washing. And, you know, probably as soon as people get the program, the first thing folks are going to be doing now is washing hands and how to guide people through the day of those things. Face coverings, what makes sense, again, for each place. Gathering limits. The day programs have been talking a lot about their physical buildings or not, because some are community-based. And what does that actual building look like? How many folks can we gather and keep our 6 feet apart? I will share that it seems like the health department is kind of grouping our day programs into childcare agencies, actually, and saying like the services should probably be a group of no more than 12 people, and that's the people who are attending and their staff, and it should be a consistent 12 every day. So like if one person is out sick, you don't fill in another person to make it 12. Lots of conversations around food preparation and distribution, like what happens when people bring their lunches and how do we keep forks and knives and glasses and everything clean and sanitized and back home. Conversations about ventilation and what's the best way. Does that mean you need to look at new ventilators? Does that mean opening windows? Of course, opening windows in Oakland in the summer is a little harder or easier than Brentwood. So lots of conversations about the best way to do that. Transportation is a big piece, and it's one that there's still a lot of work and conversation and thought going into. You know, how do you keep people 6 feet apart in a van? Some agencies are saying maybe they'll just transport one person a trip. But if there's a group of people living together in a group home, then maybe all of them should ride together in the van. And a lot of the day programs, I know families like yourselves will be just taking people on your own. So lots of still unknown and energy going into figuring that out. Readiness plans and person-centered choices. The day programs have actually created a tool to help kind of survey, and probably some of you have already received that survey from some of the day programs, that kind of starts talking about and trying to capture people's desire to go back to program versus their safety of going back to program. And I'll talk again about that in just a little bit. And then the day programs have been sharing a lot about just new methods and models, because like I said earlier, what we left is not going to be what it looks like when we return. Lisa, can you slide me over?
Yeah, I hope. There. Reimagined, yeah.
Just some of the conversations about reimagining, and this is just some of the possibilities. You will hear the day services and the day programs start talking about virtual options and how much can they do with somebody via Zoom and technology like that. For many folks we serve, that's going to be a great option. And for some we serve, that's not going to be a great option. You'll see some day programs start talking about split days. So, you know, one group comes half a day in the morning and then maybe another group half day in the afternoon. Some are talking about rotating groups. So one group of 12, that same consistent 12 might come Monday, Wednesday, Friday, another group Tuesday, Thursday. One possible scenario is doing 5 days on for one group of 12 and then off for 10 days. Then there's hybrids of all of that, like maybe 4 days in person and some days remote. Some just looking at trying to do individual supports, like almost in-home as best as they can. And there's always the conversation about this group of 12 needs to be the same group of 12. And again, that's the folks we serve and their staff every day on site, that we can't really start mingling that for people's safety. Out of that, you're also going to hear day programs talk about other ideas they're coming up. Yeah. Lisa, can you slide me to the next one?
Yeah. There you go.
So here's a couple thoughts. Whatever we are thinking now and whatever we are planning now may in some cases work beautifully, and in other cases there's going to be all sorts of hiccups and glitches. And our community, I think right now, just needs to have nothing but patience with each other as we try to move forward. There's going to be so many questions and not always a lot of good answers. One of the things I think we also need to be prepared for is a lot of the folks I know who are anxious to get back to program because this is their social life may not be, they may not like what they go back to. It may not be as much fun with the restrictions of distancing or the groups. It may not be quite as exciting to them as what it was. And the other thing I just want to keep pointing us back to is the whole person-centered model and the ID team. The day programs have done a lot of work about talking about being person-centered. I know our case managers here are trained, and we've been talking about the best way to do that. But really in that person-centered approach, you start with what's important to a person and then what's important for a person, and you start balancing that out as best as you can. Lisa, would you slide me one more time?
There you go.
Thanks. And that's kind of a little bit of an example of how that could look. So for example, if we're working with somebody who they distance well, they wear masks, they are really happy and ready to go back to program, you know, there's low risk. They know how to keep themselves safe, they're washing their hands, and they really want to go back. Maybe they're living with family who have to kind of get back to work. There's a lot of reason that makes sense that they would go back. Well, that's kind of like low risk, high benefit. That's probably people we would suggest goes back. To the other end of it, we might have people who really have no desire to go back, along with maybe some health things that we're really afraid of. That group is probably a group we're going to say, maybe let's not do that this round. Let's wait and see what we can put in place to where we do all feel safe with that group going back. The beauty of that is we will meet people, each person we serve individually, and the challenge of that is it's got to all be done individually. There's no one rule that's going to figure that out across the board. So there's be a lot of conversations that's going to take to happen as people are moving back. And then as the day services are welcoming people back into their programs, and then just dealing with the constant change of what's happening. So I think that's probably enough for me for now.
Okay, I'll stop sharing right now, Mike. And I think we have questions in the chat, so I'm going to open that up first. There it is, and see what we have there. Okay, the first question, let me go to the beginning here. There's a lot of questions about some educational things, and I think the questions about returning to school are very similar to the questions about returning to day programs. So that's important. So think about whether someone is healthy in general or not. The question Mike talked about people who are willing to wear a mask versus people who can't wear a mask. And the next question is, if someone can't handle wearing the face mask, is it okay for them to use the face shield without the face mask? So yes, the answer is yes. There are some recommendations to put a cloth at the bottom or something like that, but it's much better to use the face shield, and most of the spread of COVID, from what we know, is through droplets, and the face shield will protect from almost all of that. We are giving out mask and hand sanitizers tomorrow. At our office, we'll be giving out a box of 50 masks for every consumer and a bottle of hand sanitizer. And if someone wants a face shield, we will also have those available. Not everyone wants a face shield. The next question is, when do you think adult programs will be open? Mike, you want to answer that?
I think what we can expect is in the month of July, we're going to start seeing people try to reopen. We're still waiting on DDS's final, that last piece about what we need to do as far as verifying. But again, everything it seems like they're going to ask for, our day programs are well ahead of knowing that information, and they're already working on that. So once we know what DDS is going to say, we're going to be able to move relatively fast, I think. They're all going to open at different speeds. They may have a huge building with 4 or 5 rooms and maybe try to do 2 or 3 groups. There's others that may just try 1 group. But I think we can expect to see that happening starting in July.
Okay, thanks, Mike. Someone asked about getting on our mailing list, and please go to our website and get your name on there. If you didn't get an email for this and you think you signed up, please put your email back there because we did get some bounce backs. We haven't posted a recording of the webinars previously. We are posting the PowerPoints, but we'll try to post the recording now. I haven't tried it yet, but we are recording, so we'll see if we can put that on our website. More information about the budget and reopening our day programs. I think what we know about the budget is it's pretty stable compared to last year. There are no reductions in what is being funded for day services or for the regional center. Let's see. Can you reuse face shields? If so, how do you sanitize? Lucy?
Yes, sorry, I forgot to talk about that. Can they hear me?
Yeah.
Maybe you can
Yeah.
hear me. You might not be able to see me, but yes, you can reuse face shields. You want to wipe them down with either a wipe, a sanitizing wipe, or just warm soapy water to wash off any of those droplets that may have been collected when worn outside. So they're very reusable. Actually, it's just plastic that can be washed. And I think the part that we'll wear is the stretchy headband that secures the shield to your head. That will probably be worn faster than the plastic does. And I think also something to remember when you're washing down the face shield or wiping down the face shield after each use outside is to also wash your hands then after you've wiped down the face shield so that you don't carry with you anything that you've wiped off of the face shield on your hands when you go about your day. So that's a great question. I forgot to mention that. And there's quite a bit of info also if anyone's interested on the efficacy of a face shield versus a face mask. And they definitely can be worn separately of each other. I just wanted to mention that sometimes you will see people wearing them together, which is even more effective to prevent the spread of COVID, but not necessary. So if someone will put up with a face shield and not a mask, then just go for the face shield, and that will be much better than not wearing anything or having someone struggle with the use of a face mask.
Okay,
So, yeah.
Thanks, Lucy. There's a question, what about early intervention programs? And there's some about the specific needs and directives related to early intervention home visitors. For early intervention programs that take place at a site, the guidance is going to be the same as really is out there for childcare programs, which is keeping the same groups of children together, having no more than 12 children in a cohort, and all the cleaning protocols. I think that a lot of children's protocols, because children may chew on toys or have more, just touching than adults would, there'll be a lot more cleaning required and probably a lot more consideration of not sharing items between children. In terms of directives related to EI home visitors, there aren't currently directives related to EI home visitors, and I think that is something that's going to have to be worked through based on whether there is enough ability to have social distancing and providing intervention services, how many people are being visited on a particular day, and those sorts of things. We have a directive that is allowing us to, if a child has not transitioned to school district services at the age of 3, regional centers may be able to continue to provide some early intervention services. And that will be on a case-by-case basis depending on whether the IEP has occurred or not. I think that the other thing with Early Start and with other services is we expect to be able to continue remote services. So if that is something that has worked and been effective for an Early Start provider, then that may continue for a while. I think we're going to have a lot of parents, especially with our young children who have medical conditions, really not wanting a lot of people in their homes. So I think it's going to be a balance with that. The next question is, are the day programs that are going to be closed, I don't know what that is, funded. So right now, what we know is that we are allowed to pay for absences for day services and other non-residential services through July 31st. We do not have any guidance about what will happen for payment, for instance, if someone provides an hour a day of remote service or 2 hours a day of day services. So we are waiting for some more information about that and what that will mean. I think this will also be a question that is going to go on for a number of months. And as we know, as we get to the winter, there will be flu, even if it's not COVID, and people will be concerned about that. And anything that DDS actually sends out will be posted on our website as well as at dds.ca.gov. Here's a question. We were looking to visit programs in the spring for my daughter to find an adult program. Are day programs even considering new clients at this time? Can they even take visitors to preview the program? That's a great question. Thanks for asking that. I do know that there is definitely a lot of uncertainty going on around day program services right now. But what we'd encourage you to do is contact the day program. Some who are operating remotely are probably going to be happy to have you join some of their remote offerings and see how those fit for your family member. And I think as they start reopening, I think many day programs are going to be interested in letting you actually view remotely what they offer as we move forward into full services. And let's see. Will day program participants and staff be required to be tested for COVID-19 before returning to program? We do not expect there to be a requirement that anyone is tested for COVID-19. However, people with symptoms or who have any concern will be tested. And I think that that's something, if you as a person or a family member have concerns about your family member, if they have a positive test or not, you can certainly go ahead and get a test, but there's not going to be a requirement. And you know, getting a test for COVID, in order to really be effective, you would have to be testing people about every 2 weeks. And at this point, that is not something that our counties are prepared to do. We may see that in the future, but I don't know. Has there been discussion about providing transportation to and from day program? Or will the lack of transportation be counted against allowing someone to return to program? You know, Mike, do you want to talk about transportation and returning to program? Do you have any thoughts on that?
There are a lot of questions about that. There has been all sorts of ideas from how can we make vans more accessible as far as spaces, like, you know, one person in the back, one person over here, and then another person up front driving. there are, I mean, actually, I'm just going to say that's just not, there's just so many questions around that we're still trying to get through that. That's probably the best answer I could say. And there's not going to be one model that fits. The programs that do their own transportation maybe have much more flexibility. If we're using paratransit or those things, we've got to deal with their regulations. Yeah, sorry.
Yes, it's not expected that parents.
But it's not expected that family members drive their family member to program. But there may be alternative arrangements. So if that is more comfortable for someone, that's probably a good option. There also may be some people who live in their own home with supports or in a group home that people get transported individually more now than we had done in the past. So that may be part of what changes. And, you know, I think the other option is maybe people who are close to public transportation, one or two people can travel together on public transportation as we move forward at this time. Because while there's risk to that, that's also not as enclosed as a vehicle might be. Someone asked what kind of proof has to be shown to receive supplies tomorrow. We'll be asking just verifying who your case manager is tomorrow, but that's all. We don't have there's no ID card or something to show you're a regional center consumer. Will LINK be available for transport to programs as in the past? We believe so. We've been talking to paratransit, and we believe that they will be, again, accepting riders. So I have another question about the specific needs and directives related to EI home visitors today. There aren't any specific directives at this point. When we get the information that comes out from DDS, there are going to be considerations for early start and for people who visit homes. Those will be what people will follow as directives for early start and what you would have to do in terms of providing early start services. Okay, we have a time for a few more questions. So I'm going to try to get through the ones in the chat. We don't have N95 masks. Those are still being reserved for hospital settings. We don't have an exact day when day programs are going to open, and it will be a gradual process. And I think we all have to think about that, as there may be times that people have to take a pause or stop. And hopefully not, but we have to plan ahead for that. About reopening and ABA programs. Same as I said about early start, there will be guidelines for people providing different services in-home. And I think that those are going to have to be done in a way that is safe for everyone participating. And if someone is a worker who is only working with one or two families providing ABA, and the families are open to someone doing that, then I think that will be possible. I think we will probably see the supervision, because those supervisors of ABA go to many families, may be done via Zoom and those sorts of things. Let's see. Some therapists have started some in-person early intervention services because some families want that. We are not giving overall permission for how the services are delivered, because we contract with private entities, and each entity develops their own plan on how to deliver services, and is following public health guidance and any licensing guidance for doing that. And we will, when we get the information from DDS, we will share it with everyone around what will be required. Right now, that's not out there, so it's not something that we can give you and say, this is what you have to do. But we are continuing to encourage remote services and really following all the guidance we're getting from public health. I do have a good answer to one question here. Any ideas to do Congresso Familiar virtually? I think we're going to get an announcement about that very soon, and I think we're going to see Congresso, at least for this year, which is something that our Spanish-speaking families have enjoyed over the years as a way to come together. We'll still be able to come together via some remote methods, and I'm excited about that as we move forward. Let's see, for speech therapy, doing virtual and that sort of thing. I see some people saying that different programs are accepting students, so I encourage you to do that. This is a good question. Will in-home daycare services be provided in lieu of day program if someone can't return to attending program? Yes, we expect that if someone is not able to attend program and they have family who are out of the home and they need supervision, yes, that will be provided. And we will be looking at each situation on an individual basis. So I think that we may see, there's a question about in the future in-home virtual therapies. I think that COVID, while being horrible that we've had to deal with this and really having horrible consequences for people who've lost their lives and their loved ones, I think we've learned some things. We've learned some things that some people prefer some things that are done via Zoom. For some people, the energy to travel and all of that is very difficult. So I think we'll be seeing more of this as a way people can get certain services. And I think in healthcare, you're also going to see a lot more remote services. So we are at the end of time. So I'm going through the questions. There's a question about a medical alert bracelet coming apart. Please call your case manager. Everyone's working, and ask them for help with getting a replacement for that. And let's see, it looked like I had, our offices physically are not open, and we don't expect to open our physical offices for a while longer, but we are providing all the services that we provide, just not having open spaces here. And we definitely won't be holding gatherings in our office spaces for quite some time. We may start with being able to hold individual meetings or something here, but not large gatherings. So I'm going to end there. I thank you today for all your questions, and feel free to put your name on our email list and use our Write to Us function on our website if you have any further questions. We will post this PowerPoint very, very soon. And we're over this weekend, I believe, we're kind of updating our website. So you might go back there on Monday and see a different website, but tell us what you think. And we'll have another one of these meetings 2 weeks from now. So thanks. Bye-bye. And we'll see you tomorrow if you come to Concord to pick up PPE.
Yay. Thank you.
Bye.
Thanks.